First, we'll look at the definition of upper respiratory tract infection. So, upper respiratory tract infection can be defined as self-limited irritation and swelling of the upper airways with associated cough and no signs of pneumonia in a patient with no other condition that will account for their symptoms, or with no history of chronic obstructive pulmonary disease, emphysema, or chronic bronchitis. Upper respiratory tract infection involve the nose, sinuses, pharynx, larynx, and large airways. In this presentation, we will discuss about 5 common upper respiratory tract infection disease. So the first one is common cold. So common cold is a viral infection of nose and throat. It is usually harmless. Many types of viruses can cause a common cold. So next we have sinusitis. So sinusitis is an inflammation of the lining of one or more of the perennial sinuses. Next we have pharyngitis. Pharyngitis is an inflammation of the mucous membrane and the underlying tissue of the pharynx. Next, we have epiglottis. So, epiglottis is an inflammation of the epiglottis. It may cause respiratory obstruction, especially in children. And last one is otitis or otitis media. Otitis media is an inflammation or infection located in the middle ear. Otitis media can occur as a result of a cold, sore throat, or respiratory infection.
Etiology: the upper respiratory tract infection is caused by the culprit virus or bacteria directly invading the inner lining of the upper airway. There are 5 different diseases which are common cold, sinusitis, otitis, pharyngitis, epiglottitis, and laryngotracheitis. Common cold: it caused by viruses. Common pathogens is rhinoviruses. Coronaviruses also responsible for 10% of the common cold cases, and some of the cases is seasonal variation incidents. Sinusitis: it's caused by viral, bacterial, and fungal infection, and it can also cause by allergies, nasal polyps, deviated nasal septum, and tooth infection. Otitis: for otitis externa, it caused by skin flora, and it may be caused by Pseudomonas aeruginosa along with other skin flora. Malignant otitis usually caused by Pseudomonas aeruginosa. For otitis media, it caused by bacteria like Streptococcus pneumonia and may also caused by respiratory viruses. Pharyngitis: it caused by bacteria, viral, and fungal infection and can also caused by non-infectious etiologies. Type A Coxsackie viruses can cause a severe ulcerative pharyngitis in children. Adenovirus and herpes simplex virus also can cause severe pharyngitis, even though it is less common. Group A beta hemolytic streptococcus is the most important bacterial agent associated with acute pharyngitis and tonsillitis. Epiglottitis and laryngotracheitis caused by Haemophilus influenza type B and most common in children, and most of the cases of laryngotracheitis are due to viruses. Parainfluenza viruses are most common, but respiratory syncytial virus, adenoviruses, influenza viruses, enteroviruses, and Mycoplasma pneumonia have been implicated.
Now, let's move to the pathogenesis of URTI. The first one is common cold. It is due to the viral invasions toward the epithelial cell of respiratory mucosa, which increase the mucosa infiltration, nasal secretion, amount of protein, and immunoglobulin. This proves that cytokines and immune mechanisms are responsible for the manifestations of the common cold. The second one is sinusitis. It is an impairment of the ciliary activity of the epithelial lining of the sinuses and increased mucus secretions due to viral infections or bacterial infection. This may lead to obstruction of the paranasal sinus ostia, which impedes drainage. The third one is pharyngitis. It is an invasion of the mucosal cell of the nasopharynx and oral cavity by viral pathogen, just like the common cold. It causes edema and hyperemia of the mucous membrane and tonsils. The fourth one is epiglottitis and laryngotracheitis. Epiglottitis may result from a viral infection of upper respiratory tract that leads to the H. influenza infection, which causes rapid progressive erythema and swelling of the epiglottis and bacteremia. Whilst laryngotracheitis usually initiated due to the viral infection in the nasopharynx, which will eventually move into the larynx and trachea, which causes airway obstruction due to the inflammation and edema. Last but not least is otitis. It is divided into otitis externa and otitis media. Otitis externa is caused by hypertemperature, humidity, trauma, allergy, tissue maceration, removal of cerumen, and alkaline pH environment, which disrupt the natural protective mechanism, thus favor the development of otitis externa. Whilst otitis media is an upper respiratory infection that extends from the nasopharynx via the eustachian tube to the middle ear.
So next, we will look at signs and symptoms for upper respiratory tract infections. So first, we have the common cold. So signs and symptoms for the common cold are a blocked or runny nose, a sore throat, headaches, muscle aches, coughing and sneezing. You will get fever, changes in taste and smell, and you will feel the pressure in the ears and face. So next we have sinusitis. So signs and symptoms for sinusitis are sinus pressure and tenderness, a sore throat, nasal discharge, a blocked nose, a reduced sense of smell, and then you will get fever. You will feel the pain around the eyes, cheeks, and forehead, and you have a bad breath. So next we have pharyngitis. So symptoms and signs for pharyngitis are a sore or scratchy nose, a sore or scratchy throat, inflammation, fever, headache, and difficulty in swallowing something. Then next we have epiglottis. So signs and symptoms for epiglottis are severe sore throat, we get fever, a muddled or hoarse voice, and then you will have an abnormal high-pitched sound when breathing in, or we call it a stridor, drooling, and difficulty in breathing. The last one is otitis. So otitis we can separate into two categories, which is for children and adults. So first we look at the children. So for children who suffer otitis, we will feel the ear pain, especially when lying down, tugging or pulling at an ear, trouble sleeping, crying more than usual, fuzziness, trouble hearing or responding to sounds, loss of balance, fever of 100 Fahrenheit or 38 degrees Celsius or higher, drainage of fluid from the ear, headache, and loss of appetite. So next we look at the adults. So adult will feel the ear pain, drainage from fluid from the ear, and trouble hearing.
Treatment. For common cold, decongestion, antipyretic, fluid and bed rest usually suffice. Restriction of activities to avoid infecting others along with good hand washing are the best measure to prevent spread of the disease. For sinusitis, it can be treated through saline nasal spray, nasal corticosteroid, over-the-counter pain reliever, decongestion, antibiotic, antifungal medication, immunotherapy, lifestyle, and home remedy. For epiglottitis, it can be treated through antibiotic, corticosteroid, and epinephrine. For otitis externa, topical medication is usually sufficient and systemic antimicrobial are rarely required. A mixture of topical antibiotic is given as a ear drop. In some circumstances, acidification of the ear canal by applying of 2% acetic acid solution may be beneficial. For the treatment of acute otitis media, amoxicillin is an effective and preferred antibiotic. Trimethoprim is also an option. It also can be treated by chemoprophylaxis. Surgical procedures such as myringotomy, adenoidectomy, and the implantation of the tympanotomy tube have proven beneficial. Lastly, pharyngitis. For viral pharyngitis, symptomatic therapy is advised. Penicillin G is the therapy of choice for streptococcal pharyngitis. Erythromycin, tetracycline, and the new macrolide are effective against mycoplasma and chlamydial infections.
Now let's go to the next subtopic, which is prognosis of upper respiratory tract infection. So prognosis for common cold is generally mild and self-limiting, with most symptoms generally improving in a week. In children, half of cases go away in 10 days and 90% in 15 days. Severe complications, if they occur, are usually in the very old, the very young, or those who are immunosuppressed. For prognosis for sinusitis, in short, chronic sinusitis can be cured but is likely to require some sort of ongoing medical treatment or plan. To find out if a patient has chronic sinusitis, a doctor will first have to do a diagnostic workup. Prognosis for pharyngitis is viral pharyngitis often goes away in 5 to 7 days. If you have bacterial pharyngitis, you will feel better after you have taken antibiotics for 2 to 3 days. You must take your antibiotic even when you are feeling better. Prognosis for epiglottitis, most people with epiglottitis recover without problems. However, when epiglottitis is not diagnosed and treated early or properly, the prognosis is poor and the condition can be fatal. Epiglottitis also can occur with other infections in adults, such as pneumonia. Prognosis for laryngotracheitis, hospitalization may be necessary, especially in infants and young children who have hypoxemia, volume depletion, a risk of airway compromise, or respiratory fatigue. And lastly, prognosis for otitis. In general, the prognosis for otitis media with effusion is good. Most episodes spontaneously resolve without intervention and may resolve undiagnosed, while for otitis externa, involves management of pain, removal of debris from the external auditory canal, administration of topical medication to control edema and infection, and avoidance of contributing factor. Most cases can be treated with over-the-counter analgesics and topical ear drops.
Now, let's move to the radiographic appearances. The first one is sinusitis, the next one is pharyngitis, the third one is epiglottitis, the fourth one is laryngotracheitis, and the last one is otitis.
take it slow.